Larry, I'm sure you've seen the messaging from Republicans about this legislation. A lot of it centers around reducing waste, fraud, and abuse. And I want to ask you first about the marketplaces, because we do know that there is marketplace fraud. I wrote about that recently, especially through these brokers that are basically taking advantage of laxer rules to get people enrolled. And I'm just wondering if you have a sense of how big of a problem that is, and is that something that should be addressed, whether through legislation or through administrative action?
Yeah, I don't think you could find anyone who would say that we shouldn't address fraud in public programs, whether that's Medicaid or the Affordable Care Act. As you said, I mean, the evidence of fraud in the ACA marketplace, particularly the federal marketplace, is being perpetrated by brokers who are switching people's plans without their knowledge, signing them up without their knowledge. And no question, I think everyone would agree we should go after that. And there have been some steps taken dating back to the Biden administration and now continuing in the Trump administration to address that. But these changes to the Affordable Care Act go well beyond fraud, waste, and abuse, both in Medicaid and the ACA. Many of the changes to the ACA would make lawfully present immigrants ineligible for coverage. You can agree or disagree with that on policy grounds, but it's not abroad. These are people here lawfully and eligible for coverage. And new requirements that make people jump through hoops to verify their income, isn't really directed at fraud. It would put paperwork burdens in front of people that would result in fewer people covered.